my name is Ivy Gio, and I'm going to talk to you today about coronary artery disease. Alright, so what you see here is going to be a normal artery on the left and a narrowing coronary artery on the right. The difference between these two is the one on the right is going to be the one where you have your disease. It shows you how the plaque is building up, it's showing you how it gets narrow and it depletes the oxygen flow and the blood flow, and this is where you get your disease from. Coronary artery disease is very common. It's common within men and women. It's common within a bunch of different races as well. So it's not limited to just one or two. It's the leading cause of death in the United States and everyone. A lot of people don't know what it is, so we're going to start with that. You can call it CAD. That's what I'm going to call it for the remainder of this video. That's the shortened version. It's a disease where the arteries that supply blood to your heart muscles, they become very narrow and hardened, and it's caused due to a buildup of cholesterol and other things. They call it plaque. It builds up on the inner walls of your arteries, and they become very narrow, and it doesn't let any kind of blood or oxygen that the heart muscle needs for it to pump and pulse, and it doesn't let any of that stuff through, so you could very possibly get physical damage to your heart muscle as well as any of the other damage that it causes, as shortness of breath, chest pain, any of these types of risk factors or symptoms that you get whenever you do get coronary artery disease. Alright, so some of the major symptoms of this disease, the first one I would ever think of is chest pain or angina. That's the most common out of all of them. Even the angina, sometimes they go down your arm. You hear about the heart attacks. People have pain in their arms, their legs, like one side, always the left. But it's just a really hard and palpitating, kind of like an elephant sitting on your chest, is what they call it. You can always experience shortness of breath as well, especially if your CAD decides to create heart failure for you. Like I said before, you can get pain in your arms and legs. It may also feel like indigestion sometimes. Most of the time in women, it feels like you have heartburn. So you might want to be aware of that. Palpitations are very common. It kind of feels like fluttering or like your heart's racing. Nausea and vomiting, that's usually a symptom like with heart attacks and everything like that. But you can also get nausea and vomiting whenever you just have coronary artery disease. Nausea and vomiting is very common with a lot of things, so that's not really one of the main ones that we look at. Most of that's going to be like your chest pain and your shortness of breath. Like any other disease, it does have risk factors to it. One of the biggest risk factor is whenever you have hypertension or high blood pressure. A family history of it as well is definitely a factor. Like if your parents had hypertension or if they had coronary artery disease, that's going to be more common for you to get it. Older age obviously would be taken into account for it as well, because older people do have more of the problems than us younger people do. Diabetes, smoking, obesity, the lack of physical activity, even hyperlipidemia, which is high cholesterol levels, they're also risk factors with people that are associated with coronary artery disease. For men and women, nothing's really different between them two. The only thing is women usually typically get this about 7 to 10 years after males do. I do know that for a fact, because my grandma actually ended up getting it about 10 years after my grandpa did. They both had open heart surgery, but they're both fine now. It's very possible that you're going to be perfectly okay. With the risk factors, if you manage them, you're going to be perfectly okay. There's a whole bunch of treatments that you can take care of. In any of the races, African Americans have a really high cardiovascular death rate, but compared to all the other ones, everybody has cardiovascular disease and coronary artery disease in their race. It's not like a major disease for any typical race. We all want to know how to prevent these types of things, right? There's several ways to prevent this. Healthy eating, that helps to improve your high cholesterol levels, which is definitely a risk factor for coronary artery disease. It also helps with diabetes if you end up having that as well. Physical activity usually combats all of your risk factors together and helps you just keep generally healthy. If you do smoke, you should definitely go ahead and quit. That way, that isn't one of the biggest risk factors for you. And the only thing you would have to end up controlling would be any of the other risk factors that you have, like related to your health. But prevention is always key. There's things that you can do to take care of it before it actually hits you. Treatments for coronary artery disease can be as complicated as surgery, but also just as easy as symptom management. There are medications that can help you control your risk factors such as hypertension, diabetes, and hyperlipidemia. You can take those medications, get those under control. That can take care of it most of the time. Surgery is really needed after your arteries are so clogged up that you're in danger of having heart attacks or heart failure or even heart tissue damage. There's 3 different surgeries they could do if you end up getting that far. It's a stent placement, a bypass surgery where they open up your chest, or you can also do a balloon angioplasty. But all of these are effective treatments for coronary artery disease. These are going to be my references. I hope you understood everything that I talked about, and I'm so glad you listened. Thank you so much.